Hello there and welcome to Senior Health Over 60, the trusted channel where we explore real, science-backed strategies to help Americans aged 60 and up live longer, feel better, and thrive in their golden years. I'm Dr. James Walker. I've spent over 3 decades working with older adults in clinics across the U.S., and if there's one thing I've learned, it's that the human body never whispers without a reason. Today's topic touches on one of those whispers that's easy to miss, but maybe your body's way of crying out for help. Let me ask you this. Have you been feeling constantly tired, even after a full night's sleep? Do you sometimes forget simple things like names, appointments, or where you placed your glasses, and just chalk it up to old age? Or maybe you've noticed some tingling in your hands or feet, or that your skin looks a little pale or yellowish lately. Here's the twist. These aren't just signs of aging. They may be your body's way of saying, hey, I need more vitamin B12. The title of today's video is 8 Strange Signs Your Body is Begging for Vitamin B12. That sounds a bit dramatic, maybe, but in my experience there's truth to it, and it's more common than most people realize, especially for older adults. Now, before we dive into the details, do us a quick favor. Like this video, share it with a friend, and subscribe to Senior Health Over 60. Your support helps us keep producing clear, meaningful, and reliable content that empowers older adults across America to take charge of their health. Let's get into it and uncover how something as simple as a missing vitamin could be holding your body back. Part I, Fatigue and Unexplained Weakness. Let's begin with one of the most common and most overlooked symptoms of vitamin B12 deficiency: fatigue and persistent weakness. Now, I'm not just talking about feeling a bit tired after a long day. I mean that kind of deep exhaustion that doesn't go away with rest. The kind where you wake up after 8 solid hours of sleep and still feel like someone pulled the plug on your energy. I remember a patient, Mary, a 72-year-old retired teacher from California. She told me she started feeling sluggish all the time. She thought it was just part of getting older, but when she began needing a nap every afternoon and started skipping her weekly bridge game because she just didn't have the energy, that's when she knew something wasn't right. Mary didn't change her diet. She didn't change her routine, yet her energy was evaporating like morning mist. After a simple blood test, we discovered her B12 levels were significantly low. A few weeks after adjusting her diet and starting a B12 supplement, her energy returned. She said it was like somebody flipped the lights back on. So why does this happen? Vitamin B12 is essential for red blood cell production. And red blood cells are your body's oxygen delivery trucks. They carry oxygen to your muscles, your brain, and every tissue in between. When B12 is low, your red blood cell count drops. That means less oxygen reaching your body, and the result: fatigue, weakness, and that frustrating mental fog. The problem is, many older adults confuse this with just getting old. But if you're doing all the right things, sleeping well, eating reasonably, staying active, and still feel drained, don't ignore it. It could be your body's quiet cry for help. And trust me, listening to that whisper could save you from months or even years of unnecessary discomfort. Part II, Mood Changes and Subtle Depression. Let's talk about something most people don't associate with a vitamin deficiency: your mood. If you found yourself feeling a bit more irritable lately, maybe more anxious than usual, or even slipping into moments of sadness you can't quite explain, you're not alone. And no, it's not just in your head. But I want to introduce you to George, a 68-year-old Navy veteran from Ohio. George was always the optimistic type, the guy who'd whistle while raking leaves or crack jokes at every family barbecue. But over the past year, something changed. His daughter noticed he'd become quieter, less engaged, sometimes snappy for no reason. He himself described it as a gray cloud that just settled in. But George didn't want to talk to anyone about it at first. He thought it was just getting older, or maybe the weight of retirement. But here's what we discovered. His vitamin B12 levels were dangerously low. See, B12 plays a crucial role in producing neurotransmitters, especially serotonin, the very chemical responsible for stabilizing mood and promoting feelings of well-being. When your body doesn't have enough B12, it's like your brain is running out of the ingredients it needs to feel balanced. After a few months of correcting his B12 deficiency with dietary changes and sublingual supplements, George called me and said, "Doc, I feel like myself again. I laugh again." That's the power of nutrients, and it reminds us that not every low mood is a psychological issue. Sometimes it's physiological, something tangible, something fixable. So if you or someone you love has been going through mood swings, irritability, or a quiet sadness that's out of character, don't dismiss it. It might not be just life. It could be your body again trying to tell you it needs help. And the good news, this is a help you can provide. Part III, pale or yellowish skin. Now let's take a look in the mirror, literally. Your skin can tell you more about your health than you might think. And when it comes to vitamin B12 deficiency, your complexion might be trying to sound the alarm before anything else does. Let me tell you about Alina, a 74-year-old former librarian from Minnesota. One day her granddaughter asked, "Grandma, why do you look so yellow?" At first, Alina laughed it off, thought maybe it was the lighting or just dry winter skin. But when a friend mentioned it too, she started to worry. When she came into my office, I noticed right away her skin had a subtle yellow tint, not quite jaundice, but not the healthy glow I'd expect either. We ran a few blood tests and confirmed what her skin had been saying all along. She was severely deficient in vitamin B12. So why does this happen? Vitamin B12 is needed for producing healthy red blood cells. When you don't have enough of it, your red blood cells become fragile and break down faster than they should. This process releases a substance called bilirubin into the bloodstream. Yes, the same pigment that causes jaundice. The result? Skin that looks pale or takes on a slightly yellow hue, especially in natural light. The tricky part is, many people dismiss it. They think they just look a bit tired or blame it on age. But when your skin tone starts to change, particularly if you haven't changed your habits or skincare products, it could be your body waving a red flag. Pay attention. Your skin might be speaking up for your blood. Mouth part IV, glossitis, and mouth pain. Have you ever had one of those mornings where your tongue just feels off? Maybe it's sore. Maybe it burns a little when you sip your coffee. Or maybe, like one of my patients once said, "Doc, it feels like I've lost all the bumps on my tongue." That patient was Linda, a 70-year-old who loved reading poetry out loud to her grandkids. But over a few weeks, she noticed her tongue felt swollen and smooth. Eating became uncomfortable. Talking even started to feel strange. She stopped enjoying mealtimes, and that's never a good sign. When we took a closer look, her tongue was bright red and inflamed. The little bumps, called papillae, had all but disappeared. It was a textbook case of glossitis, and in her case, it was tied directly to a vitamin B12 deficiency. Here's what happens. B12 helps maintain healthy cells, including the ones that line your mouth and tongue. Without it, those tissues can become inflamed, painful, and prone to damage. That's when you get glossitis, or even worse, mouth ulcers that sting with every bite or sip. And the truth is, many folks chalk this up to dental issues or spicy food. But if you notice persistent tongue pain, burning, or smoothness that doesn't improve, don't ignore it. In Linda's case, after a few weeks of B12 therapy, her symptoms eased. She told me she could finally enjoy her morning tea again. Sometimes, it's the little things, like tasting your food or reading aloud with comfort, that remind you just how important your nutrients really are. So if your mouth is trying to tell you something, listen. It may be more than just a sore spot. Hand part V, tingling and numbness in the hands or feet. Let's talk about something that might seem minor at first. Those little tingles or numb spots in your hands and feet. You know what I mean. That pins and needles feeling, like your foot fell asleep, but it just won't wake up. Now imagine that feeling happens while you're sitting still, or worse, while you're walking across the kitchen with a cup of coffee in your hand. That's what happened to Robert, a 76-year-old retired postman from Oregon. He came to see me after nearly tripping on his porch steps twice in 1 week. He said he couldn't quite feel the floor under his feet the way he used to. His hands felt clumsy, like they belonged to someone else. And sometimes, when writing a grocery list, he'd notice a weird prickling sensation in his fingers. We ran some tests and found a clear cause: a serious vitamin B12 deficiency that had begun affecting his nervous system. Here's why that happens. B12 plays a vital role in keeping the protective covering around your nerves, called the myelin sheath, strong and intact. Think of it like the insulation on electrical wires. Without enough B12, that covering starts to break down. Nerve signals don't travel the way they should. You lose sensation. You lose coordination. And in time, you lose your confidence in movement. Robert's story isn't rare. In fact, I see this a lot in people over 60. They think it's arthritis or circulation or just aging. But the truth is, when B12 runs low, it can slowly rob you of balance, strength, and sure-footedness. After a few months of targeted treatment, Robert regained his stability and his peace of mind. He now walks his dog every morning without fear. So if you've been feeling strange sensations in your hands or feet, don't shrug it off. Your nerves might be asking for help, and B12 could be the missing piece. Red part VI. Irregular heartbeat and heart palpitations. Let's shift gears for a moment and talk about something that always gets our attention: your heart. Now, we all know that occasional flutter. Maybe it's when you're nervous before a doctor's appointment or watching a tight football game. But what if your heart starts racing for no reason? What if you're sitting quietly in your chair, reading the morning paper, and suddenly feel that pounding in your chest? That's exactly what happened to Margaret, a 71-year-old grandmother from Georgia. She described it as a butterfly trapped in her chest. No pain, just a strange, rapid beat that left her feeling uneasy and short of breath. Her EKG showed no major issues. Her blood pressure was fine, but a deeper dive into her blood work showed something critical. Her vitamin B12 levels were far below normal. Here's how that connects. Low B12 can lead to a type of anemia that decreases the number of healthy red blood cells. That means less oxygen being delivered to your tissues, including your heart. And when your heart senses a lack of oxygen, it compensates by beating faster, harder, and more erratically. Over time, this can stress your heart muscle, especially if it's already been working for 7 decades or more. Once we corrected Margaret's deficiency, her palpitations eased, her energy improved, and her fear lifted. She went back to her morning walks, this time without that strange flutter shadowing every step. If you've noticed heart flutters, racing, or that thumping feeling when there shouldn't be one, don't ignore it. Your heart is trying to stay strong for you, and sometimes it just needs the right tools to do its job. Part VII, memory loss and cognitive decline. Let's talk about something we all joke about from time to time: forgetfulness. We've all done it. Walked into a room and forgot why. Misplaced the car keys. Called the grandkids by the wrong name. It happens. But when those moments start to add up, when the fog feels heavier and more frequent, it's worth asking, is this really just aging? I remember a patient named Harold. He was 73, a retired engineer from Michigan, always sharp as a tack, but over several months his wife noticed changes. He'd forget their lunch plans, struggle to follow conversations. Once he left the stove on and completely forgot he'd started boiling water. They feared the worst, early dementia. But here's the twist: it wasn't dementia. It was a severe vitamin B12 deficiency. You see, B12 is critical for brain health. It supports the formation of the myelin sheath that insulates nerve cells, including those in your brain. When B12 levels dip, your neurons lose their efficiency. Signals slow down. Memory falters. Focus fades. Harold's blood work showed critically low B12, and we got to work right away. With regular injections and a diet rich in B12-rich foods, the fog began to lift. He told me, "Doc, I feel like someone cleaned the windows in my head." And he meant it. We're so quick to blame age for every mental slip. But sometimes the mind is not fading, it's just undernourished. And that's good news. Because a nutritional cause is something we can address, something we can fix. So if your mind doesn't feel as sharp as it used to, if words slip away or memories feel murky, don't assume the worst. Sometimes it's not about aging. It's about awareness. And vitamin B12 might be just what your brain has been waiting for. Detective part VII, subtle symptoms that often go unnoticed. Not every sign of a B12 deficiency grabs your attention right away. Some sneak in quietly, so quietly in fact that many folks chalk them up to just one of those days. But let me tell you, your body rarely speaks without a reason. Take Martha, for example. She's 69, lives in Arizona, and is as active as they come. But over the last year, she noticed something odd. She'd get winded climbing a single flight of stairs. She started losing weight, even though she wasn't dieting. Her vision blurred slightly when reading recipes, and she began feeling off balance while walking through the grocery store. At first, she thought she was just getting older. But as her symptoms built up, she knew it was more than that. When we tested her vitamin levels, sure enough, she was borderline deficient in B12. Here's what happens. When B12 is low, oxygen delivery to tissues drops. Your body starts slowing down in subtle ways. You might notice shortness of breath even with light activity. You might lose weight because your digestion isn't working as efficiently. You may develop vision changes, dizziness, or even feel like your legs aren't quite steady beneath you. Individually, these signs seem like minor nuisances. Together, they tell a story your blood can confirm. The key is awareness. If something feels off, pay attention, especially when several small things add up over time. You know your body better than anyone. Trust that instinct. Because in many cases, what feels like a dozen little problems may point to one root cause, and thankfully, one that's often easy to treat. Cut of meat part IX, how to prevent and restore healthy B12 levels. Now that we've explored all these signals your body might be sending, let's talk about something even more empowering, what you can do about it. Because here's the good news. A vitamin B12 deficiency is not only treatable, it's often preventable. One of the first steps I recommend to my patients is to get your B12 levels checked annually, especially if you're over 60. It's a simple blood test, and it can save you from months or years of avoidable symptoms. If you've had gastric surgery, deal with digestive issues, or take medications like metformin or acid reducers, you may be at higher risk and should monitor more closely. As for your diet, let's bring it back to the table literally. Vitamin B12 is found almost exclusively in animal products. That means if you eat lean meats, poultry, fish, eggs, and dairy, you're likely getting a decent supply. One of the most concentrated sources is organ meat, especially liver. I know, it's not everyone's favorite, but it's a powerhouse when it comes to B12. For my vegan and vegetarian friends, the road is a bit trickier. Because plant-based foods don't naturally contain B12, you'll need to rely on fortified products like nutritional yeast, certain plant-based milks and cereals. And in many cases, supplementation becomes essential. When it comes to supplements, I often recommend methylcobalamin, a form of B12 that's easier for the body to absorb, especially when taken as a sublingual tablet that dissolves under the tongue. It bypasses the digestive system and goes straight into the bloodstream, an ideal route for older adults with absorption issues. And remember, this isn't about chasing perfection. It's about staying proactive, informed, and in tune with your body. B12 isn't a miracle cure, but it's a fundamental piece of your overall well-being. When it's missing, everything feels a little harder. When it's restored, life gets a little clearer, steadier, and brighter. Because you deserve to feel good, not just today, but every day ahead. Compass Part X of final thoughts and takeaway. As we wrap up this conversation, I want to leave you with something simple but powerful. Your body talks to you. The question is, are you listening? We've covered a lot today. From fatigue that just won't quit, to brain fog, to a tongue that feels off, to heart flutters and numb toes, each of these can be a clue, a signal, a whisper from your body that something is missing. And in many cases, that something is vitamin B12. What I hope you take away from this isn't fear, but awareness. Because awareness is the first step to action. And action, especially when it comes to your health, is always worth it. Check in with yourself. Ask questions, get tested, and nourish your body with what it truly needs. Aging isn't about slowing down, it's about getting smarter about how we care for the only body we'll ever have. And if this video helped you see things a little differently, helped you connect the dots, or